Crisis response program CAHOOTS is now separating itself from the nonprofit that created it, Whitebird, as Whitebird's future remains uncertain. Thanks for joining us tonight. I'm Kendall Bartley. Brandon Cameraman is on assignment. Now, it's been 20 days since CAHOOTS stopped operating in Eugene, and those behind the nationally acclaimed model say they are determined to rebuild and return to the streets of Eugene. KVAL's Tiffany Lewis sat down with former employees for an update.
For the first time in nearly 3 weeks, we're hearing directly from CAHOOTS workers about the future of their program and their fight to keep this national model here in Eugene. Earlier this month, Whitebird Clinic and the city ended their contract after the clinic laid off staff and said it couldn't maintain the agreed-upon hours in the contract, 24/7 services.
We are working behind the scenes to try to get more partners on board, more funding on board, more opportunity to return to the city of Eugene and provide this service. We have the staff.
Despite being laid off, many former CAHOOTS staff members are working behind the scenes to create a sustainable future for the mobile crisis program, even if it means operating independently from their original parent organization, Whitebird Clinic. One option under serious consideration, forming an independent nonprofit. CAHOOTS leaders say separating from Whitebird Clinic could give the team more administrative control over securing sustainable funding as Whitebird Clinic navigates financial instability. The immediate challenge, however, is where their own funding would come from, and they're hoping to work with the city directly.
We really need some fiscal sponsorship support on two different levels. One, in terms of securing some funding so we can project a business plan that makes sense to the city of Eugene, and also a fiscal sponsor to help our workers get back on the road and do that while we figure out our next steps.
After Whitebird Clinic's contract with the city ended on April 7th, residents implored the city council to find a way to continue funding CAHOOTS. The city of Eugene just released their biennial budget proposal with deep budget cuts. $1.5 million, 0.5% of Eugene's general fund, is no longer set aside for alternative crisis response services.
I do think the city has a responsibility. We've been, for very little money for a really long time, making a really significant impact in what public safety looks like, and we see ourselves as a valid and essential third arm of public safety.
It's a deal. For us to take about half of the welfare checks that go on in the city of Eugene, the other half being done by the police, right? And if we're not there, that means there's, thousands of these calls that an officer needs to go respond to, or somebody needs to go respond to. I think that
last Monday, Whitebird launched a portal for people to create fundraisers supporting CAHOOTS, but CAHOOTS workers posted on social media telling people to stop donating to the clinic. In their post, they said Whitebird laying off 80% of CAHOOTS staff and not honoring their contract with the city of Eugene was the push CAHOOTS needed to strike out on their own. With an average of 45 calls a day, CAHOOTS says they've missed more than 900 calls over the last 21 days.
We help police be accountable to the community. We help EMS workers be accountable to the community. We ourselves are accountable to the community as kind of watchers on the wall. We get to be this human decency that continues to be a part of the nervous system of the city. And I think that will be sorely missed.
In Eugene, I'm Tiffany Lewis reporting.
Lane County's Mobile Crisis Services says it's responded to 166 calls since CAHOOTS stopped operating in Eugene. That's an average of 8 calls per day countywide.